around with an update on COVID. Please take the next few minutes to watch this informative video. We will have more updates as the week goes on. Have a great day.
Initially, we held a virtual meeting where we presented data on COVID-19, sort of the cases, and really the most affected areas in Orange County, which included Anaheim.
Our demographics reflect the most vulnerable populations in Orange County: essential workers, multi-generational families that are living in very close quarters.
The hotspots were sort of in the heart of the areas that their students live. We quickly began to move, and the school district said, let's work together. We need to bring this data to our community, and we would like for them to sort of get activated in ways that they can lead education, outreach support to reduce the transmission of COVID in those hotspots.
This is a partnership between AUHSD, Latino Health Access, the Orange County Healthcare Agency, and the UCI School of Public Health, as well as one of our ongoing partners, the OCAPICA. We were able to bring in about 120 student leaders from 10 high schools across the district, trained up by Latino Health Access and the UCI School of Public Health, many doctors who trained them up on the facts involved with stopping the spread. Our goal is to leverage and work with the students to have them lead 30,000 students, we're a 7 through 12 district, in their families and also different peer groups, to raise awareness, raise public education so we can stop the spread in central Anaheim.
The summit was incredibly important because it replaced fears with facts. We all understand that we're going through a pandemic, but I don't think we all comprehend what goes on around it, such as contact tracing, the health inequities, where to go for free testing. And that's where the Latino Health Access Group came in, with sharing that at our disposal, saying this is where we can go, this is what we can provide, here are the resources. This was so much more than a doctor or a professor just telling us what we need to know, but it was a conversation. We were able to clear everything up and bring to light what's really important and how to move forward from this.
As long-term goals for the Youth Summit, students are creating campaigns to spread information. The 4 groups of campaigns include TED Talk/podcast, the social media group, music/spoken word, and short video production. Students are creating important pieces of content to spread to the AUHSD community in order to save lives.
This is important because we're here to protect the youth, and not only them physically, but also mentally and emotionally. We're all taking the position of having a student-led effort to reach our communities. Our most important goal is to just stop the spread of infection, and again, to make our youth feel educated and safe. So along with North Orange County ROP, AUHSD, and Latino Health Access, we think we're going to be able to make a huge impact.
Youth are the ones that are at the forefront of pushing our society to be better, to make change, and seeing that Anaheim Union already has the structure of youth leadership. We're so excited to create space for them to understand what's going on with the pandemic, both at a medical science level, but also how it's playing out in our communities and how it might affect them in the long run.